I want to start by thanking Prime Minister for his strong leadership on this very difficult issue in our sub-region. We must recall that this is a $1.8 billion problem, which is almost 16% of our national income in the currency union. And as he has indicated, we are attacking it in 4 parts: property, health, traditional life, annuities. I'm very pleased to join him today to say a few words on the second element, which is the health insurance. Let me also recognize Karen Dental, who is our legal consultant and who has worked extraordinarily hard on this. And Karen, I want to thank you very much on behalf of the people of our region for your work on this. And Kamala Jean-Baptiste Aaron, who is the spokesperson for the fund. We thought it appropriate to have a spokesperson appointed to ensure that all of your questions on this fund, which we are launching today, can be answered in a very timely and in a very efficient manner. I also wish to recognize the other members of the core committee who are not here. Those include Karen de Freitas Reit, who is the Deputy Solicitor General in Antigua and Barbuda, Hudson Carr and Bronte Duncan of the Eastern Caribbean Central Bank, Rodney Lester and Caroline Cerruti. It's a team. And as Prime Minister said, we've been working very hard to try to provide advice to our governments on this difficult problem. Now, as Prime Minister just said, persons who have valid health claims have not been paid. So you have situations where perhaps for as many as 2 years, people have had these claims that have been unpaid because of the collapse of British American. So I want to say a few words on how the fund will work. The fund will pay out valid claims under British American health insurance policies. And I do want to reiterate, it will not pay claims to persons who have annuities with medical needs. Unfortunately, we do not have resources to address that particular problem in this fund. So this is for persons with valid health insurance claims. Health insurance claims incurred up to today, May 18th, 2011, will be paid in full once they have been deemed to be eligible and they have been appropriately verified. They will be paid in full. We expect that we will have enough funds in this fund to be able to pay all claims up to today, May 18th, 2011. Between May 19th and June 19th, we will do our best to pay claims arising over the next month if we have additional monies or surplus monies after we have paid the claims up to May 18, 2011. So we are guaranteeing the persons with valid claims up to May 18th will be paid in full, and if there are funds remaining, we will go for another month up to June 19, 2011. After that, the fund will not be able to pay any more claims for people who have claims after June 11th. Now, just a minute. You will actually be able to apply to this fund between now, today, and December 31st, 2011. So I want to say we're giving enough time for people to be able to actually apply, and there's a 2-step process which I will speak to in a minute. The first process is that you must have your claim approved by British American Insurance Company, as you would in a normal manner if British American was still a viable and going concern. So that's the first step. Once a claim is approved by British American, the second step is to apply to the health fund. Now remember, the health fund is not a fund of British American. The health fund is a fund facilitated by the governments of the Eastern Caribbean Union, Currency Union, to help policyholders. So British American will verify, then you apply to the fund with an application form that will be available in all of our branches across the Eastern Caribbean Currency Union, all British American branches, insurance branches, and there you will make your application. We will need to, of course, prepare the application and process it, and we will ask you to give us no more than 90 days to be able to give you a check. So the idea is that from the date of application, within 90 days, you should receive your check from the fund. We expect that policyholders will find satisfaction in the fund once they have gone through this two-step process. Because of the large volume of applicants we anticipate, especially in the initial period, because remember, people have not been paid for some time, we have decided to take an alphabetical order approach to how we receive applications in the first month. And in the press release and in the newspaper ad which will appear this week in all of the countries, you will see which names are supposed to be when. After the first month, you can come in at any time, regardless of where you are in the alphabet. But just to ensure that there is some order and there is some ease of facilitation, we have, and the branch managers, we discussed that with the branches. We agreed that for the first month, we will take the applications in alphabetical order. We're very pleased that we're finally able to deliver on this fund as promised by the governments and by the committee chaired by Prime Minister Gonsalves. And we believe that it will provide some relief to policyholders at a time when clearly many of them are experiencing hardship. So that in a nutshell is how the fund will work, and I will stop there for the time being. Thank you.